So I'd start by checking the MAR in the order and then doing my 6 rights of medication. Then I would set up the bag and the stuff in the med room and make sure that the gauge is appropriate for my patient, the size is appropriate for the medication giving, and the flow rate and the amount is appropriate for the size of my patient as well. Then I would set up my stuff before I went into the room. I'd be checking my bag for particulates, any discoloration, the expiration, and the amount, and then what is being given. Then I'd set up my label with my name when I've given it, a room number, start date, my initials, the bag number, the hour rate. So if we're starting at 1:30, it should be done at 6:30, and then my drop in minute. And place this on the bag. You would never write Sharpie just on the bag. And then I would get my tubing, make sure my size is appropriate, make sure there's no broken pieces in there, and the expiration. So I'd start with priming my bag. I'd make sure not to contaminate them. Make sure this is locked. And I need 28 drops per minute, so it's 7 every 15 seconds. So when I go to prime my tubing, this would just be over in
I can hold it.
okay. That would just be in the garbage. And I would fill this halfway full. Make sure I get all the bubbles out. Then I'd count for 15 seconds to make sure I get 7 drops for 15 seconds. And then I would lock it. Then I'd be ready to enter my patient's room. And then I would label the tube with the expiration and when it needs to be changed and my initials and the gauge of the needle used. So then when I go into my patient's room, knock, wash my hands, explain the procedure, what they're getting, the amount, and when, over the duration of when they're going to be getting their medication. Answer any questions they have. Then I'd raise the bed to the appropriate height, provide privacy, and get adequate lighting for myself. I'd put a dressing under a linen saver. I'd apply my tourniquet. Check for radial pulse, make sure I don't have an artery. And I would palpate the vein. Then I would clean my site. Then let it air dry, and I'd pop the tourniquet while I'm setting up my stuff. would get a new one. This is my new one. I wash my hands, put my gloves on. Reapply my tourniquet. Let air dry. I'll be ready to start my IV. Make sure it's bevel up. I would anchor my vein. Push in a little farther. And I'll thread my catheter. Click my safety. Then I would do the clover. This is to secure the catheter from getting pulled out. Then I put my gauze under it. And another piece of tape. Actually, I'll use my once I flushed it to make sure it works. So next I would do my saline lock. And I would make sure it flushes. Or flush it with 5 cc's. Then I'd put my swab under there just to stabilize it. Then I'd use my clear IV cover to cover the IV site. And on this, it's got your name, date, initials, and a gauge and needle. So you'd write that on the cover. And then I would secure this right there. Since I'm here, I have gloves on. Then I would hook up my IV that's hanging. Unlock it. I had already set my drops per min. And make sure it's dripping and hanging and running.